Hi guys, my name is Etelvina Esquivel, and welcome to my presentation for public health on COVID-19. So the main points that are going to be mentioned in my presentation is the issue and detail of COVID-19, the importance to public health, and ways to improve this issue and prevention strategies that have been mentioned by public health organizations and government officials. So what is COVID-19, also known as coronavirus? According to the Centers for Disease Control and Prevention, it is an infectious disease that can cause a mild to moderate respiratory illness. It spreads through droplets from sneezes and coughs, and any age group can get COVID-19, but those at a higher risk are people with previous medical problems or those of older age, according to the CDC. The U.S. National Library of Medicine states that the first reported case was on December 12, 2019 in Wuhan, China. So why is COVID-19 important to public health, or why does it relate to public health? Well, this pandemic has caused over 22 million people in the United States to file for unemployment, and many have lost their health insurance because of this. If many people don't have their health insurance, there's going to be a lot of people who are going to be afraid to go to the doctor because they're unemployed and they don't have the funds to be able to pay for their treatment of COVID-19. Also, there has been a shutdown of non-essential businesses by the government, and this has spiked a fear of a recession from happening. Hospitals have overflowed with patients, and many hospital workers and healthcare workers do not have face masks to protect themselves because of a shortage of face masks. They often have to rely on reusing their face masks, washing their hands before putting it on, washing their hands after. And often, many nurses have also have to put their face masks in boxes, toppers, so they can use it again for work. And also, one important thing is that there's no vaccine, and we know how important vaccines are to preventing people from getting sick. So the more we last with no vaccine, the more cases of COVID-19 will probably increase from now. So some of the symptoms of COVID-19 include fever, tiredness, dry cough, sore throat, shortness of breath, and new loss of taste or smell, as stated by the World Health Organization, also known as WHO, and the CDC. So, for the cases of COVID-19, I have split them into 3 sections by worldwide, the United States, and Nevada. Worldwide, according to Johns Hopkins University, there are 3.4 million confirmed cases, and there has been 243,355 deaths, and 187 countries and regions have been affected by coronavirus. In the United States, the first case was on January 15th in Washington State, and the first death was on February 29th in Washington State, according to the CDC. Currently in the United States, there's 1 million cases and 64,283 deaths because of COVID-19. In Nevada, the first case was on March 4th, 2020, and the first death was on March 15th, 2020, according to the State of Nevada Department of Health and Human Services. Currently, in Nevada, there are 5,000 cases and 257 deaths statewide. Something else that also has been happening because of COVID-19 is the amount of hate crimes and racist sentiments towards Asian and Asian Americans. It has been increasing to about 1,000 cases of discrimination towards Asian and Asian Americans in California alone. And I think this is very scary to think about, that not only are people getting sick, but there's also people getting attacked because of their ethnicity and or their nationality. And I think during a pandemic, or any time really, there really shouldn't be this much hate to a group of people. Moving on, I'm going to be talking about prevention strategies. So, according to the CDC, they state that social distancing or keeping space between yourself and other people can prevent the spread of COVID-19. Something else that they also talk about is quarantining in your home. So, only leave for work if you are an essential worker, and only leave if you're shopping for essentials, which is groceries or medicine that you might need, or anything else. Also, stay 6 feet apart from people when going out for essentials, and by essentials, like going to groceries or going to the doctor if you have to go. Washing your hands after you come back from a trip to the grocery store or going out for essential stuff. Or if you are sick, wash your hands for more than 20 seconds. Avoid crowded areas, for example. Avoid any protests, concerts, parties, and social gatherings. But because of many tips from World Health Organization, many concerts have been canceled. The CDC and WHO also are very diligent in telling people that if you are sick, stay home and quarantine yourself for 2 weeks. They also mention that please, if you are doing social gatherings, to limit yourself from a group of 10 people. But of course, during this time, we shouldn't be social gathering. We should be staying at home to prevent the spread of COVID-19. If we keep following these rules that the CDC and WHO and other public health professionals and organizations have stated, we can flatten the curve, and hopefully this quarantine and lockdown doesn't last for too long. Thank you guys for watching and listening.